infections, and now we're going to talk about fungal infections. The only difference is bacterial infections are caused by bacteria and fungal infections are caused by fungus. So, the fungal infections of the mouth that we want to focus on are candida or candidiasis and deep fungal infections. So, different types of candida. So we know that when you have a candida infection, you have an overgrowth of the bacteria flora Candida albicans, which is a normal flora in the mouth. So basically there can be 3 different things that cause this to grow out of control. You can have HIV, can be caused by dentures that aren't cleaned, or corticosteroids or antibiotics. It could be a side effect. How do you know if you have a Candida infection? Well, basically, the organisms are identified if they are able to be wiped off the lesion. So if you scrape the lesion and it wipes off clean, that's Candida. So you have lots of types of Candida. Pseudomembranous, erythematous, denture, chronic hyperplastic, angular cheilitis, chronic mucocutaneous, and median rhomboid glossitis. So basically, it's important to know simple things about these because she's going to ask on the test a little simple phrase from each one and you need to put them in order. So, pseudomembranous Candida. This is a white curd-like material on the mucosal surface. This is the one that if you wipe off, you see redness underneath. The patient may complain of burning or a metallic taste. So, pseudomembranous. Just think it's the one that when you wipe off, there's redness underneath. That's what it looks like in the mouth. Little white curds, cottage cheese looking, and that's what it looks like on the mucosa. That's pseudomembranous candidus. So now you have erythematous candidias. This is different than the other types because it's just a really thick redness. You don't really see white happening. So that's easier to remember. Erythematous candidus is a red candidus, and it's often super painful on the mucosa. It may be localized to one area or maybe more generalized. There it is in the mouth. See that super redness compared to the healthy palate pink tissue, and then there's super deep redness. And then on the tongue, really red spots of no fungiform papillae. Okay, now you have denture stomatitis. This is also known as chronic atrophic candidias. So, stomatitis, what does that mean? Inflammation of the mouth. So, chronic atrophic candidias, or denture stomatitis, means you're having candida growth from dentures not being taken out, and it's causing inflammation. This is the most common type of candidias, because most people who are affected have dentures. So the mucosa is red, but the change is limited to the mucosa only that's covered by the denture. So this is how you determine whether it's erythematous candidias or denture stomatitis candidias. If the redness is only where the denture touches the mucosa, then you know it's a denture issue. Basically, the redness just follows the outline of the denture, and it usually doesn't cause too much pain, whereas the erythematous candidias causes a lot of pain. So there you can see the normal pink, white, soft palate, and then on the hard palate is all this redness, and that's where the edge of the denture is. Okay. And then you have chronic hyperplastic candidias, or candidioleucoplakia. This is diagnosed based on when you try to wipe it away and it doesn't wipe off. It's stuck there. This type of candida will respond to an antifungal medication, and if it doesn't and it's still a lesion, then it should be biopsied. If you So basically, this is chronic hyperplastic candidiasis is also one that you could use therapeutic diagnosis on. So if you give them an antibiotic and you know it goes away, you know that it was chronic hyperplastic candidiasis, because those are the ones that respond to antifungal medication. So there it is in the mouth, and that whiteness does not go away. So let's just review the candidiasis again real quick so that we're good to go for those. Okay? So, pseudomembranous. What's the biggest thing to remember? It's white, curd-like. It can be wiped off, and underneath is redness, and it's burning or metallic taste. Pseudomembranous. Burning or metallic taste, can be wiped off, white, curd-like. Erythematous candidiasis. Super, super painful. Only seen as red, not white at all. Denture stomatitis, or chronic atrophic candidiasis. This is only redness seen where the denture is, and it's not painful. Then you have chronic hyperplastic candidiasis, or candidal leukoplakia. This is when the white lesion cannot be wiped off, and it does respond to antifungal medications. Alright. And then you have angular cheilitis, which is also a form of candida, but this one's easier to remember because it's redness or fissuring happening in the labial commissures, which are the corners of the mouth. And angular cheilitis usually occurs from candida, but it can also happen due to nutritional deficiency. What two things that you are deficient in will cause angular cheilitis? Vitamin B and iron. So be careful not to confuse angular cheilitis with actinic cheilitis or solar cheilitis. That is when you have the sunburn-looking lesion on the lips and the vermilion border is diminished, whereas angular cheilitis is the corners of the mouth. Okay. Chronic mucocutaneous candidiasis. This is a severe form that occurs in patients who are immunocompromised and can't fight off the bacteria. Fungus, not bacteria, fungus. The patient has chronic oral and genital mucosa candidiasis and skin lesions as well. Basically, this is easy to remember because it can occur anywhere that you have mucocutaneous tissue. Chronic mucocutaneous candidiasis, severe form in the oral area, genital area, and skin mucocutaneous tissue. And then you have median rhomboid glossitis. This is when you have a red rhomboid shape on the tongue, on the back of the tongue, and it can be flat or raised. And Candida has been the source of it in some lesions, and some lesions disappear with antifungal treatment. So it's kind of tricky. But median rhomboid glossitis, this is when you have the redness, rhomboid shape in the back of the tongue. How do you treat that? Well, basically, you need to diagnose it and make sure that's what it is. You can do a mucosal smear and then send it to the lab to diagnose it. In some patients, candidiasis is persistent and will reoccur. It may be a sign of a severe underlying medical problem. So that's rhomboid median glossitis, or median rhomboid glossitis. Again, a rhomboid shape redness on the back of the tongue. Okay, so that was all the forms of Candida. Now you have deep fungal infections. Deep fungal infections are oral lesions that are caused by histoplasmosis, coccidomycosis or valley fever fungus, blastomycosis, and cryptococcus. So these funguses are all primarily involved in the lungs, and there is regional distribution of these lesions. So how do you diagnose these lesions from each other? You have to have a biopsy or a microscopic examination. In the mouth, they are preceded by involvement of the lungs. And in the mouth, they're chronic non-healing ulcers, and they can look a lot like squamous cell carcinoma, which is the oral cancer. They're treated by antifungal meds, just like any fungus, and they can have latent infections, that may appear and reappear if the immune system is still deficient. So that's what it can look like in the mouth. So yeah, deep fungal infections. The main thing that we need to know about this is mycosis is valley fever. Coccidiomycosis is valley fever fungus. And yeah, so those were fungal infections.